in-person event, a 2-day event again this year, whereas we've changed up the format a bit. What we've heard from people is they really wanted more of a networking, collaborative, and problem-solving event. So our first day is going to be focused on tackling some of the most wicked questions that you're facing. So we'll have some collaborative sessions, lightning labs that are going to be facilitated for everyone to tackle some of the challenges around HR, around technology, around how do we meet our clients' needs in that sense. So we encourage everyone to register. Registration is open. It's October 18th and 19th. And we've just announced our first keynote, which is going to open day one, Ron Tite, who's an emerging leader in innovation and disruption. So we're going to have a bit of a promo video that we're going to be able to share with people later this week to give you a sneak peek about how he's going to bring his energy and his thought about growth both in terms of organizational sense, but also as individuals as to how we can use a growth mindset to tackle some of the biggest challenges we face. Another thing that we know is a big challenge, and this is something as an association we hope we'll be able to provide you with some information to help tackle it, is compensation and HHR issues. So we know that it's one of the biggest challenges when it comes to the sector in terms of retaining and recruiting staff, the challenges we face compared to other sectors. And in the past, we've done a sector-specific benchmarking study that helps you identify what's really needed in terms of salary and compensation. What we've taken a bit of a different approach this year is we've partnered with all of the great associations and organizations you see on the slide right now. So Addictions and Mental Health, Advantage Ontario, the Alliance for Healthier Communities, the Association of Family Health Teams, CMHA Ontario, Children's Mental Health Ontario, Family Services, the Indigenous Primary Healthcare Council, and the Nurse Practitioner-led Association to do a complete community health salary benchmark to really understand and get a really big picture of it there. So there'll be 79 key positions that are going to be examined, with a number of 34 that are specific to CSS and home and community care. So there will be a good sample of what's happening in our sector there. It's open right now, so I really encourage you to go and fill it out. It should have reached your inbox through OCSA members. And we'll have both regional and sector breakdowns included in the analysis. So really encourage everyone to fill out the survey. So the first part of my presentation was very much to talk about some of the pressures we're all feeling, give a bit of a provincial overview of some of what we've heard, what we're advocating about for. And in the second part of the conversation, I'm really hoping we have a lot of questions. So I'm going to be peppering you with a lot of questions and have a discussion as to how we can move forward, both from a regional and local approach as to what the new structures are giving us the opportunity through OH regional structures, but also OHTs, and just to try to identify some opportunities there. So over the past month, a big focus of our advocacy has been around the capacity and financial pressures facing the sector. In December, as CAPS processes started, we heard from a lot of you that you had reached a breaking point, something that hadn't happened in 50 years from some organization or in the entire history of their organization. They were looking at cutting services. And we started hearing that story from a lot of members. And it wasn't just, oh, we'll have to adjust by a little bit of 5% or things like that. It was significant reductions and a lot of use. So what we wanted to do was obtain a bigger picture of what was happening across the province. And what we found, is some of you might have seen these numbers before, is 66% of the sector was planning some sort of reduction in service. That was actually just pure service numbers. And then an additional 22 were planning on limiting access either through wait lists or increasing client fees. So this is almost, when we look at these numbers, 88% of organizations across the board were looking at doing something that would impact access and ultimately have negative impact on our clients, which is unprecedented in our sector, not only in the scope, but also in the size of it. And then when we asked members to quantify what this meant, it was very much like, this is what it meant. A 27% reduction across the various services, which is significant again. Over 200,000 fewer rides to medical appointments. almost 900,000 hours of care across the various services, almost 500,000 client interactions, 641,000 meals, and 101 days of service cuts through ADP's assisted living programs, those who measure in those sense. So for you, I think a lot of you will recognize yourselves in these numbers, as we know you were some of who filled those surveys out. So we've had conversations with the province, and I'll get about that with the province and the financial needs and some updates on those negotiations that are happening there. But this was very much real impacts to real clients, and that caught the government's attention, not as much as we hoped, but ultimately they did get there. And I think that ties to some of the comments Dan was making earlier about understanding the sector in terms of the complexity and how we actually take care of clients. Because when we talk about the impact our services have, we don't have the one metric or the one amount of things. Like just even on this slide, we show 5 or 6 different ways as to how we measure our impact on clients. And I think that's something we can talk a bit about later as well in terms of how we measure things. We know that some of the biggest drivers of our capacity challenges, as I've mentioned, is not only the financial piece of it, but the HR and the volunteer piece of it. So I'll touch on both of them. The first one on some of the HR challenges, what drives them, is the compensation, but also working conditions. In the fall, we did a survey asking about your rates in terms of vacancies, but also why people were leaving. And there were some interesting nuances to understand there, that it was about wages, yes. But for PSWs, it was as much about the working conditions as it was about the pure wages as to why people were leaving. Things like burnout, things like the ability to do the job as part of a team, and all those kind of conditions. So wages being an important component of it, but also like everything else that makes a job satisfying in terms of the ability to manage, and feel complete in your work. On the nursing side, it was a bit unique, and the nursing focusing a bit more on the home care piece, knowing that the nursing in CSS is a more limited scope, is that they were leaving for really opportunities under the part of the health system. Whereas PSWs were leaving for as much as just leaving the health system, nursing tended to just simply leave for the hospital pays me $10 an hour more. And knowing in our positions, we'd all do the same for our families in that idea there. So some interesting nuances to understand when we want to talk about HR challenges. We've left the peak of the vacancy rates of last year, where we were seeing like 30% vacancy rates across the sectors. We haven't come down to where we'd like to see them. We're in between the 8 to 20% range. Hospitals recently showed they were around the 12%, so it's across sectors in that sense, in that way. It's gotten better. We're not where we'd like to be, essentially, is what I was trying to show with this slide here. Volunteers, we know that CSS, we wouldn't be able to do what we do without them and without the caregivers. Again, Dan was talking about how many hours are actually given by caregivers and volunteers across the system. And if we were to try replace all of that labor and volunteers with paid staff, the system would simply just crumble. And we hear from caregivers and others that their burden has only increased. They're now asked to take on tasks under supervision that would usually be done by nurses or PSWs, right? There's more and more that we ask of them, and more complex tasks of it. And I think on the caregiver piece, that's a real challenge. In terms of volunteer challenges, the pandemic changed how we see volunteers, how we utilize them, given that there was an over-reliance on older volunteers that now we're being told you have to isolate throughout the pandemic. And we've really seen this, especially on the Meals on Wheels experience through the Ontario Community Support Program, where we really saw and had the opportunity to talk with members of being like, yeah, I'm using staff to deliver the meals now, and I just haven't been able to shift back to full volunteers because they haven't come back. And then they were talked about the ability to screen and onboard and support volunteers virtually. And we all felt it. It's the gasoline costs, and all of a sudden people were like, I just simply can't afford to volunteer with you. It's just, I'd like to, and that touches on the funding issue of I can't volunteer when the gas is that high in terms of cost. So when we talk about the challenges facing our sector in terms of volunteers, staffing, and funding in terms of the ability to deliver these services. We were hoping budget 2023 would deliver more good news than it did, and it did deliver some good news, and we're still in the process of anticipating more good news in that sense. So there was a significant commitment to home care in the budget that was called out, and our understanding is that was very much called out through for political reasons, as the budget itself is that. And in terms of commitment to CSS and independent living, we have had good conversation with the province and obtained a commitment for significant investment into community support services and independent living. What I was hoping to be able to do today is kind of, as part of our negotiations with government, give you a better idea of what significant commitment meant in that sense. In our pre-budget conversation with the province, in our submission, we talked about a 7% base to increase plus a $5 an hour, a 5% increase to salaries across board. So coming to 12% as the need for what's needed across the sector. Post-budget, we've continued to echo the need for that number with the government, and the government hasn't pushed back to say, like, well, those are really unreasonable numbers, blah, blah, blah. They keep saying that there will be a significant investment towards the sector. We saw other sectors, like in terms of home and community care, home care, 300 million in contract rates, that depending on how it gets framed out, that's about a 5 to 7% rate increase. Community mental health got a 5% rate. I'm hoping and optimistic we might see something in that range. We'll see. I can't confirm anything there, but we are optimistic about it. I think we were going to escalate our advocacy with a press conference, but as you know, after conversations with the province, we felt we had enough of a commitment that we could call it off. So what does that mean if we do get all that money? We had a good conversation this morning with Dan talking about the drivers for demand about the province actually becoming one of the first super aged societies, and in terms of just building long-term care capacity, historic investment just to tread water, essentially, is what we're going to be doing there. So we know it's coming up. It's coming. And what can we do in terms of making sure we have those other opportunities? We know people want to age safely and where they want to do it, and that being at home. There's a few references to the Denmark model in terms of the ability to keep people at home. I'm just going to recite another stat that Dan mentioned of 30% of all new health spending will be likely trending towards long-term care just to be able to do that. And if we look at the Denmark model, is they have 3.7% of seniors live in long-term care. In Ontario, we're at 4.8% if we keep that. And it's an interesting, the money has to be there to make something like that happen. In Denmark, it's 64% of the funding is based for community care services when we look at the combined envelope of CSS, home care, and long-term care. In Ontario, we're closer at a 51-49, and that's 51 being in long-term care. So we really need to do a fundamental shift in terms of how we fund things if we want to achieve something of the same. And if we're going to be reducing our number of per capita beds, even with a massive historic investment in long-term care, we need a similar, if not bigger, significant investment in home and community care just to kind of stay where we're at, really. So what is a way to increase capacity within the sector and meet that challenge? Over the past year at the association, we've invested in some research on the investment for wage parity and what that would mean. Because we know that one of the bigger challenges I've talked about is we're losing staff to other sectors, but also other health sectors, but also other sectors that aren't health related, especially on PSWs. So we commissioned a research paper that looked at what would be the return on investment if we created wage parity with long-term care for PSWs in the province. So what that research found, based on similar research in the United States and other jurisdiction, is wage parity actually has an impact of about 20% on people leaving. So 1 in 5 PSWs who would have left the sector would have been retained with wage parity and would be retained going forward. So what would that mean is 23.5 million additional care hours for the province in terms of the ability to take care of that. And what would those 23.5 million hours of care allow us to do is shift about 26% of our healthcare expenditures by offering those care in the community where it's cheaper than in long-term care. And this is with wage parity. This is 26% of savings with wage parity. So even factoring in that our salaries are now higher, the sector is still a more cost-effective place to take care of people, and it's where people want to be. And we can see ultimately a 26% reduction in healthcare expenditures in caring for that population. So this is something we've really tried to make it important on the province to understand where we're going. So the next part of my presentation, I want to take some of these thoughts of the systemic issues that we're facing, some of the challenges that we want to go, and some of the opportunities, and translate the conversation in terms of what we can do as organizations, as an association, but also as regional collaboratives and local networks who are developing towards OHTs to make this shift of a model successful, to set up our sector for success and set up our clients for success and being taken care of where they'd like to be taken care of, essentially, which is at home. So we've had some conversations this morning about the importance of what we measure. How do we measure it? Matt talked about how his experience of measuring led to increasing the equity lens on things. Understanding that the macro indicators might say, yeah, things are getting right. Things are getting better for some people, but when we dug down, it wasn't for everyone in terms of understanding there. And I think this was also where Sumi's conversation was really interesting in her lessons learned about integration and it being local and not trying to boil the ocean for everyone, but really understanding what are we trying to do for who? And I think this is what our sector can do. We've had a bit of innovations in the past few years with the federal funding that created some home care indicators as to what it was. And I think we've started that shift to really understand the indicators can't be hospital focused in terms of understanding, or acute care focused or institutional care focused, because that's not necessarily what we're trying to do. Is not acute out, but community in. I think that's an important focus when we start to think about that. So when we design indicators and start that conversation, to keep that in mind, I just wanted to flag some of these there that we started to use in terms of the conversation. How do we understand demand? This is going to do a bit of a callback. These reports, you see the dates 2015, it's a while ago, about these capacity plans that were done by the Mississauga, Halton, and Central West Lynn. And I think this is where the opportunity of the OHTs and the regions are a unique perspective, understanding both local and regional demands, because some of our services that we offer are very much localized and they work great. And the smaller they are in terms of meeting the communities, the better they are. But there are still some things that are needed to be at a bit more of a regional lens. And this is where we can, for those who were part of the high priorities neighborhood conversations, I think we've managed to do some interesting measures there in understanding the demand and the impact that our services have on it there to bring up. So Ontario health teams and the Ontario health structure have opened up some different opportunities in terms of scale and spread. And I think this is where the conversation for this group is really interesting in terms of bringing up those unique innovations that are happening locally and maybe giving them a bit of a regional structure to help them spread a bit more. Susan mentioned some of those unique things that are happening around the 7 new leading projects that are happening in home and community care, and those that are happening here in the central region. And then in terms of the clinical care pathways, and I think that's an interesting place where especially some of those that are there, our community can take a bigger role in them to really understand, being like, hey, the preventative piece needs to be into these clinical care pathways that in the past haven't necessarily been there, based on the fact that we've had a more acute focused presentation or approach to these ones there. There are some interesting comments that were made, and for me, the conversation around the next step for OHTs out of that paper is the focus on regional or provincial standard on processes, but decisions and outcomes being a bit more locally driven. And if we think about it that way from a sector's perspective, what is it that we really need to lead in terms of like, okay, this is a process that we want standardized from a province perspective? Like Dan made the point of like, there's not really a standard investment model for CSS and what does it mean? But then locally, those needs are very different in terms of what's needed, in terms of why not all ADPs are the same, is because all communities are a bit different, and their needs in terms of who needs what service to stay at home are a bit different. And how do we reconcile those two differences in terms of as a sector? And I think that's where there are opportunities for conversations at conferences like this to happen. So what I wanted to use the rest of my time with you is to have a bit of a conversation about what challenges and what opportunities are best addressed utilizing Ontario health teams or local partnerships, and what challenges and what opportunities are best addressed utilizing Ontario Health Central or a more regional approach. You've noted here, I've left out the province's approach. I think what we can do is identify those, parking lot them, and we can take them as an association, and at our conference have opportunities to discuss those. But for this conversation, keep it a bit more of the local and regional approach to help you identify other opportunities for collaboration going forward. So with that, Ray, I'll turn it back over to you to help us moderate a discussion, and thank you to everyone for your attention and for the conversation.
Thanks so much, Patrick. Again, very informative presentation, tremendous value in terms of the community support services sector and the data that you brought forward, which is very current and very much top of mind. I think I'll just mention to frame this conversation quickly as well, that this is the first in a series of conferences that the advisory committee see going forward. We already have had discussions about a fall conference, something later in the fall that we would be able to pull some of the data and some of the key issues and concerns that we raised today, and then flesh them out in a next conference. And I think what Patrick's looking for is creating some stimulation around that opportunity. So we're looking for comments or questions from the audience in this regard. At this point, I have two comments, not specific to that. They came in a little earlier, so I'll just give people a minute to respond to Patrick's question. Not a question, but a comment re unprecedented surface cuts. In the early 2000s, the dialogue among CSS providers was that we were ultimately shooting ourselves in the foot from an advocacy perspective, because in a commitment to best respond to growing client needs, the sector always found a way to stretch our dollars. While it is devastating to be cutting service, it does mean that we are no longer hiding the cumulative impact of the continued lack of funding for the sector. So that's just a comment from one of our colleagues.
Can I address that for a second?
Yeah, of course.
And I think this was the fact that in the past, we've always, I use the royal we for the sector, and it's very much you doing the heavy lifting of making it work for the client, making it work. And the government, quote unquote, took advantage of it because it did. And I think when this year we said, this is it, like that's the wall, this is where we're at. And that's one of the reasons it took notice a bit more. It is because historically we'd made it work, and now it's just, it was at a breaking point. And I think that's one of the reasons we've been we'll see where we land, but been a bit more successful in that way.
Thanks so much.
It's frustrating to say that that's what it took. And for some organizations, I know in the Champlain region, where they spearheaded a lot of this advocacy, they've already started some of those reductions, and some of the client impacts have been felt already. We're hoping that ultimately the funding will be enough to reverse some of those impacts to clients. But yeah.
Mhm, mhm. Yeah, good response. Next comment I have is what also needs to be addressed, which is difficult, I acknowledge, is sick time of frontline staff and providing better training for frontline supervisors and managers. PSWs don't just leave because of salary, they leave because they don't feel appreciated and recognized. And I know, Patrick, you did address that. Would you like to
Yeah,
further respond?
yeah, and I think that it's very much true, and that's what we saw. It's not just the salary. The salary is a piece of it, but it's not just that. It's the different training opportunities. It's moving away from just simply the transactional approach to HR, and a more complete holistic approach to understanding everything that needs to happen there. And I think that's where some opportunities do exist with integrations or collaborations with other sectors, and in learning that and bringing it a bit more of a whole person approach to how we not only care for clients, but also how we care for our staff.
Mhm. Yeah. What can regional municipalities do to support local community organizations?
This is an interesting question, and I think there's some really good opportunities around regional municipalities, and I'll bring it back to one of my experiences at the Central West Lynn, actually. When I was the French language services coordinator there, the region of Peel played a great role in a bit of being a community facilitator and a community leader to bring other community groups that went beyond health in terms of facilitating a table. And it was with things as simply as taking a bit of a lead in terms of providing some administrative support for the communities to come together, the different organizations, and collaborate and provide integration. It leads to things like service fairs, just having a space for like the local immigration groups to talk with the local community groups, and things like that, and to foster that collaboration. And I think that's where regional municipalities have a great role in terms of just having a bit more of those resources, and especially administrative supports. Something as simple as sometimes like having someone to help coordinate, but also offering space. And that's where we saw some really good innovations come out of it that way. And when we're talking, especially bringing an approach to equity seeking groups, where they might be a bit under resourced or not necessarily under resourced, but also just not necessarily having the same connections as everyone else, to play that facilitator role there. And I think that's a really good opportunity there. And some municipalities also have the great ability to advocate in ways that other organizations don't, being a bigger voice, having some of those connections in that front. And that goes on the other side for providers as well, is connect with your local municipal politicians to help be a voice to advocate for you as well.
Mhm, mhm. Yeah, really good point. And of course, the group you're referring to, the CRT or the Community Roundtable, has continued into version 2.0, we call it. And we have new leadership and support, and the region is very much behind the work that we're doing and bringing a very large audience of agencies, individuals, and groups together, which do represent a multiplicity of services, both health and human services. So there really is good examples of how the municipalities are engaging and supporting the work of the community that we engage in. The community sector also finds a way to do whatever it takes to service our clients, dollars or no dollars. And this sort of goes back to shooting ourselves in the foot and not insisting on funding what I call full cost. We're always finding ourselves shorting ourselves. Anything further on this item?
Yeah, and this was an interesting conversation. I'll bring it back to what Sumi said as part of it in terms of her 7 laws of integrations that was there. That there was this idea that integration won't necessarily save you money, especially not in the short term. That you need to invest to make it happen. But then also that from a client perspective, a patient perspective, it might not save money as well. What it will do is get you better outcomes. And one of those reasons why it might not save you money, especially when it comes to clients, is integrated care is really great at identifying unmet need. And I think what our sector has been great at is identifying those unmet needs and finding ways to meet those needs without necessarily uh, getting funded for it or connecting with other organizations, but not necessarily bringing that up to funders in that sense. So one of the things I'm hopeful and something that might come out of the Ontario Health Team developments is the ability to really understand what wraparound services are, what's happening in the community, and then ultimately bring that up to the attention of everyone who funds the system and understands the system as part of that return on investment. That all of the things that you do through volunteers, through supporting caregivers and like that, gets brought up to the attention of caregivers and really of decision makers, and really flags the value of the sector in that sense. So yeah.
Yeah, good comment. The next comment is, I think there's also need to have a serious discussion of bad home care providers with no consequences of quality of care being provided.
Yeah. I think that this also fits in the broader conversation as to how as the indicators of what we want to measure in terms of quality and outcomes.
Right.
I think you can't hide behind bad service if you're measuring outcomes. And I think that's part of that conversation is moving away from counting just a visit. Was the visit there? It tells us a visit happened. It doesn't tell us what happened in the visit or how that visit impacted people. So I think that's part of that whole conversation when we talk about what do we value and what do we measure. I think those outcomes become very important.
Yeah, I think the other opportunity is the focus through Ontario Health Teams as well on patient engagement and co-design. I think this is where a real opportunity comes in for us to sharpen what we call quality versus what the clients
Mhm.
or caregivers may see as quality being delivered. So I think there's some real opportunities there for improvements across the board. More of a comment from a PSW perspective, some of the challenges beyond salary, rather total compensation, which includes the ability to participate in pension contributions, which creates a bit of a circular argument. Those that remain the lowest paid and remain part of the marginalized workforce cannot afford to contribute to the community sector in the same way that institutional type salaries enable. Thus is also creating the most vulnerable workforce as they age. The opportunity to plan for health human resources in a comprehensive way rather than organization specific or limited, so that we can create more sustainability for the frontline workforce rather than inadvertent competition.
Yeah, and I think what's an interesting opportunity here is we have an organization in the Ottawa region who recently made a transition to Hoop for both the community sports sector side and its home care service offerings. And what they're doing is tracking the impact on recruitment and retention, the ability to move there. So we'll hopefully have some really understanding there. And yeah, it's a really great point. There are marginal workforce, and when you're part of the low wage is dollars and cents matter more short term than a long term pension, and it's difficult. Like when you're struggling to make ends meet, yeah, you'll keep that money because you need it right then and there.
Mhm. Next question around, Dan mentioned in his presentations, the best thing we can do is invite policymakers and government out to our programs to see the work that's going on and help them better understand the work beyond briefing notes. Do you have any thoughts about this, Patrick?
Oh, it's a great idea. 100% do it. If you need any help in terms of setting it up, you're not sure how to go about doing it, please do reach out. We're happy to help facilitate that kind of thing. It's even when I was at the Lynn, I did that for at the start. I went and visited an adult day program to really understand what it was, and it's really changes your perspective to really understand how it was. Even when I first joined the association, Ray was a gracious host in terms of understanding of showing us what his assisted living services program really did, and it really does change perspectives to see it. Yeah, so I 100% agree with Dan's comments there. I see there was a comment to put my slides back up, so I'll just
Yeah, I
do that
saw that.
quickly.
Thank you. Yeah, I just noticed that. I have one more question
Mhm.
right now. Sorry, I'm just going through them. Oh, yeah. Were there any comments regarding the impact of traveling home? I think they're referring when they asked to the survey,
Mhm.
in CSS maintaining employees.
Doesn't come up right now. I could double check, see if it was any
Okay.
specific comments, but it didn't come up enough as a theme
Mhm,
to that
mhm.
the travel was a big barrier to it. It
Okay.
might have been, if there was comments around travel, it might have been related to compensation related to travel, but not the actual traveling.
Yeah,
Yeah,
that's where my mind went to,
yeah.
Patrick. And just to mention to the audience that that very last comment you just made, you and I've had, of course, a lot of conversation about it back and forth. There seems to be a variance on how the policy around the $3 an hour wage enhancement that came out, a couple of years back and then permanently this past fiscal, that there's questions about how that $3 can be utilized. In other words, is it only for direct face-to-face service? And or can it be used for other directly related components such as travel expenses for those that are in the community and they're traveling using a vehicle, etc. So I don't know if you have any comments on that, whether that's come up in discussions or negotiations with the province, but that is a concern. And there does seem to be now, I'm getting more information from across the province that's telling me there could be a variation on a theme here and interpretation in different communities, which we would hope would not be the case. We would hope that any increase being provided and directed by the province to the agencies to, of course, pass through directly through payroll to their employees, which we all support, should be covered for all mandatory expenses.
Yeah, and this is one of those issues that we've had conversation with the province. We included the call for it to be to all hours in
Mhm.
our pre-budget submission. It's one of those conversations with the government that when we talk about educating about the the ministry and different decision makers about the nuances within the sectors and even subsectors within home and community care. It's a challenging one to educate there, but we're hoping to have some more clarity come out on it, and it is part of the conversations. Unfortunately, I don't have any more specific information to share here.
Okay. Next question, in order to compete for the scarce PSWs in the system, is there a way for the sector, CSS sector, similar to the way long-term care has, to leverage government funding to build an employment brand strategy?
Okay.
This is related
If
to,
yeah,
sorry, demonstrating the value of working in the
working in this,
sector. Yeah, yeah.
yeah, there was something, and this is where we partnered with Home Care Ontario on a PSW. It was a bit more home care focused on that sense, but I think it's something similar to that kind of strategy someone is thinking here. I think there was a bit of work done in that sense, but something broader might be what someone's asking about here. So there was the whole Work for Life campaign that talked about some of the benefits there. I can share some of that information with folks after as well.
Okay, great. The other one I have is, do you have concerns that the Ontario Health Team Care pathways remain clinical, medical? Would love to see more preventative approaches incorporated into the pathways, seniors active living centers, for example, CSS programs, public health, acute, and rehab.
Yeah. And I think in some of those pathways, I think there is the opportunity to quote unquote insert yourself in that discussion to make them more upstream focused. I think when Matt was talking about the priorities in your health plan, especially the right care at the right place, being like a conversation about preventative care. I think this is one of those that as they're happening at the local and regional levels, the first early adopters of these clinical pathways to kind of bring yourself to the table, be like, hey, you know what really helps lower limb amputation with diabetes is more preventative care around diabetes in terms of education, in terms of early follow-ups, in terms of those things. What helps with congestive heart failure is more upstream services and those kind of things. I think it's part of that discussion, and it's an opportunity to, as they're happening at the local and regional places, just being like, have you thought about this? Can I be part of this discussion? And to a certain extent, just if you're not invited, find the right person and invite yourself to the conversation, for lack of a better way to do it. Yeah.
Any last thoughts, Patrick, at this point, in terms of, what you heard here today as a participant and what you presented and what OCSA has learned about the sector and some of the pressures and challenges that we're faced with?
Yeah, I think in terms of what the opportunity really is for the sector, and Dan's comment about like the pace of change within 2 years versus 10 years, I think our capacity challenges make it feel like we're in immediate challenges and we need to address some short-term gaps, and they really are, and we really need to. But to take the opportunity to really say in 10 years, this is what it could look like, and take that leadership role. And I think this conference highlighted a lot of that, of the things that are happening there in terms of what's happening. So share the lessons learned and keep doing it that way. We're here to try to support you. If there anything that you think from a provincial perspective would help you go beyond that, oh, I need to understand this to be able to make that 10-year thought change, let us know. We're always trying to find ways to especially support members in that front. We've got the advocacy piece where we're really pushing to try to get you that funding to allow for that reprieve on the local real pressures that you're facing. So it's a balancing act from our perspective as well to do the short term and the long term, but to be at the table is probably, and at the tables like this today, some great thinking and some great conversations, and to keep there. So yeah.
Thank you so much, Patrick, for joining us and sharing always openly with the membership and all the other providers in this Central Ontario Health region. I want to go back and thank, all of the 5 session presenters who did a superb job, to the planning team who helped bring this all together over the last couple of months. Of course, to our CSS sector colleagues all across Ontario Health Central, some 111 providers. And we're just delighted to have so many of you with us today, both staff, board, and volunteers. And for having a really open and informative dialogue on the critical role of community support services within a transforming healthcare system that we're all trying to, figure out and work through together and bring to fruition. And of course, the Ontario Health Teams is a big part of that. So we do want to thank everybody. So really collaborative group of people. We'll look forward to, we're going to have a CSS advisory committee meeting later this week. So we'll do a report back and highlight and start thinking about what we may be doing in the fall of this year. Hopefully we'll be coming back with another conference, something quite different in terms of format, and utilize and leverage the good information that we've all shared with each other today. Once again, thanks for being with us. We really appreciate it.